Hello, and welcome to this presentation about how to read your Medicare Summary Notice. This video is presented through the Wisconsin State Health Insurance Assistance Program, or SHIP, a local public service for people with Medicare. Every state has a SHIP program. Here in Wisconsin, in addition to the SHIP helpline, there are SHIP counselors available in every county to help with Medicare questions. You can find a counselor in your county through your local Aging and Disability Resource Center or by calling the SHIP helpline and asking for a counselor near you. The toll-free SHIP helpline is 1-800-242-1060. I am Ingrid Kundinger, Project Manager with the Wisconsin Senior Medicare Patrol, and I will be sharing the importance of reviewing a Medicare summary notice on a regular basis to detect possible Medicare fraud, errors, or abuse. What is the Senior Medicare Patrol Program, or SMP? The SMP is a federally funded grant program through the Administration for Community Living. It is available in all 50 states and the 4 United States territories. The Wisconsin program is housed at the Greater Wisconsin Agency on Aging Resources, or GWAR. The Senior Medicare Patrol is a volunteer-focused program, and all services and resources provided are free and confidential. The mission of the Wisconsin Senior Medicare Patrol is to empower and assist Medicare beneficiaries, their family members, and caregivers to prevent, detect, and report healthcare fraud, errors, and abuse through outreach, counseling, and education. So now that you know that we have a Senior Medicare Patrol program, perhaps you're wondering why it's needed. Unfortunately, Medicare fraud, abuse, and errors are a billion-dollar industry for the fraudsters. Yes, that's correct, billion with a B. While this presentation will not focus on Medicare-related fraud schemes, I am hopeful that you will understand the importance of reviewing your Medicare summary notices on a regular basis, a role that we can all play in being better healthcare consumers. A Medicare Summary Notice, or MSN, is a notice that people with original Medicare receive in the mail every 3 months for their Medicare Part A and Part B covered services. If you did not receive any services or medical supplies during that 3-month period, you would not receive a Medicare Summary Notice for that period. You can also receive your Medicare Summary Notices electronically. This means that instead of waiting 3 months for a paper copy to arrive in the mail, you will get an email with a link to your Medicare Summary Notice each month. Information about how to create a secure Medicare account will be provided at the end of this presentation. The Medicare Summary Notice for Part A, or hospital insurance, would show all services billed to Medicare for inpatient care in hospitals, skilled nursing facility care, hospice care, and home health care services. The Medicare Summary Notices for Part B, or medical insurance, will show all services billed by Medicare for doctor's services, hospital outpatient care, home health care, preventive services, and other medical services and equipment, including durable medical equipment, for example, back or knee braces. The Medicare Summary Notice shows all services or supplies that providers and suppliers billed to Medicare during that 3-month period, what Medicare paid, and the maximum amount you may owe the provider. It is important to remember that the Medicare Summary Notice is not a bill or invoice, but rather it is a statement. Often we hear people say, yes, I know I get something from Medicare, but I don't ever look at it, or I'm not really sure what it is, so I don't really pay a lot of attention to it. It's important that we pay attention to the Medicare Summary Notice, because that is going to be the accurate, or hopefully accurate, description of your Medicare covered health care. You want to make sure that it is an accurate reflection of your health care and what your Medicare benefits have covered for you. That is why it is so important. If there are things on there that do not make sense, that are suspicious or possibly fraudulent, or perhaps errors, if we don't look at the statement, we will never know if everything is accurate. We will never ask questions of the provider or report suspicious claims for additional investigation. Please promise me that you will make an effort to look at these statements. Now, they can be a little confusing, I will say that, but once you get in the habit of knowing what you're looking for and on which page, It should not be too difficult or time consuming. And again, it is important. So it's multiple pages. So be prepared that there will be multiple pages in that envelope from Medicare. Let's take a look at each page. For this example, a Medicare summary notice for Part B covered services will be used. This is a sample Medicare summary notice that is found on the Medicare.gov website. Page 1 is the dashboard page, which is a summary of your notice. Information that will be found on this page include your information, name, Medicare number, dates of claims listed, your deductible information, so the deductible status is available right on the front page of this document, the total you may be billed, providers that you saw or suppliers that provided medical equipment or supplies, and information for assistance in languages other than English or Spanish should you need them. Page 2 is called Making the Most of Your Medicare and provides helpful tips on how to review your notice along with other important information, including how to report suspected fraud, how to get help with Medicare questions, preventive services that are covered by Medicare, and general messages from Medicare. In this example, the general messages include information about a pneumonia shot, how to report a change of address, information about mammography, and how to create a secure Medicare account. These messages change often, so remember to look at it each time you receive a Medicare summary notice. Now to page 3, the claims information. This is the part of the Medicare summary notice that you are really going to want to take a look at closely to make sure it is accurate. This page will include a definition section, which provides definitions for the columns used. For example, service approved, amount provider charged, etc. The next section is called Your Visit. Look closely to make sure that the date listed is accurate, along with the healthcare provider. It is a good idea to keep your bills and compare them to your notice to be sure that you received all the services listed. The service description section provides user-friendly language that will make it easy for you to know what you were treated for. Sometimes healthcare jargon can be confusing, so this user-friendly language is helpful. Also included on this page is whether your claim was approved, the maximum amount you would be billed. Remember, again, this is a statement, not a bill, and a notes column, which refers you to the bottom of the page for additional explanations. The notes on this example indicate that the claim was sent to the Medicare Supplement Insurance or Medigap policy XYZ. So, while this page, or pages if multiple services are included in this 3-month period, can be a little overwhelming until you take the time to look and break it down and know what you're looking for. The most important thing to review is that the claim is accurate. The date and service provider are familiar to you, and the service description matches what happened during the visit. Okay, I hope you're still with me. We're almost there. This is the last page, which will provide more details about your options as it relates to denied claims. If you decide to appeal, you have 120 days to appeal your claims. The date that your appeal must be received by Medicare is listed on this page, along with resources if you need help with your appeal. And lastly, the appeals form is part of this final page as well and provides step-by-step directions to complete. Just to quickly summarize what you're looking for when you're reviewing your Medicare summary notice. You're looking at your visit dates, making sure that the providers and facilities are familiar to you, that the service descriptions that are listed on your Medicare summary notice match the services received during your visit, and just double checking the payment amounts that you may be billed for. So what are the red flags that you could be looking for or should be looking for? The provider name or location that is not familiar to you. For example, if you live in Madison and all your healthcare providers are in the greater Madison area, a provider name and location from California would be suspicious, especially if you did not travel to California or did not receive care while there. That would be a red flag and something to ask questions about. Double billing for services. Did you receive a flu shot, but it was listed twice? This would be a red flag and something to call and ask your provider to review and correct. Services that were not ordered by your healthcare provider or services that you did not receive. Maybe something was just added to your statement, hoping that you would not catch it. And you know what? If you don't look at your Medicare summary notice, you would not catch it, and Medicare would pay for something that they shouldn't have. What if I don't understand a claim or it seems suspicious? Call your provider and ask questions until you understand the claim. Be your own best advocate. Call Medicare at 1-800-MEDICARE to get more information or to ask questions. You can also call the Wisconsin Senior Medicare Patrol's toll-free helpline at 1-888-818-2611 for additional assistance. To report suspicious claims or to ask questions about your Medicare summary notice, please reach out to the Wisconsin Senior Medicare Patrol. Again, our toll-free helpline number is 1-888-818-2611. In addition to providing assistance via our helpline, we also publish a quarterly newsletter, fraud alerts as necessary, and have other materials available to you. We are also available for presentations should you be interested in learning more about how to prevent, detect, and report Medicare fraud, abuse, and errors. To find out more about the Senior Medicare Patrol or to learn about volunteer opportunities, please give us a call. To create a secure Medicare account so that you can have access to an electronic Medicare summary notice monthly, go to the Medicare website, which is medicare.gov. Please make sure that you go to medicare.gov, which is the official Medicare website. On the medicare.gov homepage, click the Login Create Account button and follow the prompts for information. Thank you for attending this video presentation. Listed here on this screen are some additional resources you may want to contact for more information or assistance. This presentation was brought to you by the Wisconsin State Health Insurance Assistance Program, or SHIP, a local public service for people with Medicare. If you have questions about Medicare, contact the Wisconsin SHIP today.